Hello all, welcome to part 1 of 2 of our newest mini masterclass with a focus on opportunities within an integrative medical approach to your health. So some of the goals for today are really going to be to just go basics on why making sure both yourself and or your family be more integrated is a great idea. Really ultimately working to share how to get to the root cause of many of the health problems that are most common in our country today, and ultimately just share opinions now based on research that I've personally read in books and on government websites and whatnot, but ultimately to share opinions on why I personally live a more integrative lifestyle and why I think for people that truly care about themselves, their health, their family, and want to live their best life, they could also benefit from chronically and continually working toward this. And, just to share a couple of stories to get started here, one of the things that really opened my eyes years ago to this whole concept of integrative medicine was that, a lot of current medical advice is still being tested. When we think about chiropractic care, no matter what your view of chiropractic care is, ultimately it's been consistent for well over 100 years. Chiropractic adjustments by hand were given in the late 1800s, and they're still given in our clinic by hand in 2021. So you look over a long enough period of time, it's proven to be safe, it's proven to be effective. There's very minimal downsides or side effects, but in an effort to be on the cutting edge, in some ways, current medical advice or current medical research doesn't know the long-term outcome of certain recommendations that they give. And while I'm going to do my best to avoid the highly politicized concepts of today, because likely you've already made your decision on jab or no jab and some of that kind of stuff. But here's something: if you go back a few decades, before aspirin was recommended for chronic arthritis pain, most places in this country did not have dialysis clinics. If you needed dialysis, if you were one of the people that had their kidneys wore out, there was such a small population that you could go to the hospital. Now, there was a change where aspirin was looked at as cheap, safe, effective, and there was a time in the medical community where if you had arthritis pain, you were recommended to take 12 to 16 aspirin a day. And of course, what was the long-term effect? It absolutely destroyed people's kidneys, causing kidney failure, causing the need for dialysis until ultimately that person passed away, in many cases from complications to having kidney damage. Now, again, was there research before it? Sure. Was the intention good? Probably. But following this, when you hear this, follow the science, follow the untested science, follow the no long-term research science, you're going to get some of these effects. Now, sometimes you won't, but sometimes you will. Now, another example of that, which is a little more personal to me, was they switched, and after aspirin with arthritis pain, one of the next recommendations was Tylenol Arthritis. Now, Tylenol Arthritis, you could take 4 a day. It was considered safe, effective. Now, my grandfather worked in a tire factory in Freeport, Illinois for 30 plus years, and really wore his back out, didn't know about chiropractic, had steroid shots, but ultimately took a lot of Tylenol Arthritis. And what was the side effect? It damaged his kidneys. Kidney failure was the largest contributing factor to him passing away, thankfully, at the late age of 88 last year, with a great life. But ultimately, what if somebody had exposed him to a much more natural alternative? I can tell you, and I've told this story to many of you that are watching. One thing I think that is, so cool, when he retired at 65, he had a lot of back issues, and when he was exposed to chiropractic treatment specifically, there's a picture of him water skiing on his 77th birthday. So even with being on medication before, making some serious lifestyle and life changes really radically improved his health and gave me personally the opportunity to know him better, see him do more, fish, do lots of things. And ultimately, what was the shift? It was a shift to a more integrative approach. The last story before I go into some of the causes of this is a lady who came to see me last Monday, and she came in and she said, I really need to talk to you. I'm having, my kidneys are starting to fail. And I said, I went through a list of questions, but one of the questions is, what are you taking for medication? And she showed me she's on 3 different medications. 2 of them are low dose and for prevention. And she said, I know I shouldn't take those. I know from coming here for the last 8 years that these low doses prevent, but I'm afraid. My doctor told me to, and he even convinced me that I should do that because he said he's on the exact same ones. And I asked him when he told me I was starting to have kidney damage. He said he was starting to have kidney damage. So you think about that. Obviously, that doctor was not malicious, but if you live in a false lifestyle that somehow that medication for prevention instead of lifestyle or alternatives is a better choice, you will reap the benefits. I'm not saying that certain times medication isn't necessary. I'm not saying it can't be life-saving. If you don't work on your lifestyle or whatever the root cause of your problem is, it may even be necessary to live longer, but ultimately, for the majority of cases, it's not the best way if you haven't explored other alternatives. And if you go ahead and say, well, why hasn't my doctor told you this or told me this? It's a great question, but it's not an answer that if you take these drugs or if you allow your body to degenerate, you're the one that dies, you're the one that hurts, you're the one that leaves your family early. So please, please, please take this information in and make the best decisions for you. So the way we're going to go through this, it's going to be 3 parts. Part 1, I'm going to go through different medications or vaccinations that what they do, what their positives are, and then what some of the literature shows, and then what the downsides are. The second part, I'm going to talk about different organs or different things that you can treat with more natural supplementation, lifestyle, and things to get more to the cause so you might not need those medications. And third, I'm going to talk about specifically action steps and what you can do. So to get started here, heart disease, still the #1 killer in America today. Top things done to prevent heart disease are still all non-reversing but managing. So high blood pressure medication, high cholesterol medication, blood thinners. Again, there's times and places for these. If your blood pressure is extremely high, you need to take a medication until you can figure out how to get it down. If you have severe pain, your blood pressure might go up. But blood pressure medication is shown to damage your kidneys. It can affect certain absorption of certain nutrients. It can affect the way that you hold water if you have to take a water pill. So what you really should look at, again, from a root cause standpoint, is blood pressure medication might keep your blood pressure lower, but the number needed to treat to prevent a heart attack or stroke with blood pressure medication is really poor. I mean, in some cases, hundreds of people have to take a blood pressure medication a day to prevent a single stroke or a single heart attack. So you think about it, the percent difference from not taking anything in many cases is less than 1%. And yet those numbers are manipulated very frequently by the drug companies to cause you to think that it might prevent by 30% or 50%. That's compared to placebo, and so keep in mind that there are ways to treat your blood pressure naturally. There's things like magnesium to relax the muscles, exercise, anti-inflammatory diets. I mean, there's some really simple things that I think a lot of people don't realize the net value of. Cholesterol drugs. I mean, if you want to talk about corruption in modern medicine, in my opinion, cholesterol drugs were one of the most egregious examples of that. It is difficult to find any literature that shows net benefit as far as decreased death rate for cholesterol drugs when people's cholesterol is between 200 and 240, and when they have a good HDL, meaning that they have if you divide your HDL, your quote unquote good cholesterol, by your total cholesterol, if it's under 5, it's tough to find any literature at all that shows that person should be on a drug. Yet, all the way back in 2001, 15 scientists, 9 of which have confirmed we're receiving more than $50,000 from the same pharmaceutical companies for consulting, just happened to change the medical guidelines from 240 down to 200. And the interesting thing is, it's now malpractice if your doctor doesn't recommend a medication. Now think about that. It's not necessarily even the doctor dictating it. It's somebody above the doctor. Now, could you lower your cholesterol in certain cases? Of course, but do different people with different genetic variances have different levels of cholesterol? Of course. And having this one number, or thinking that the lower the better, is the best choice. In fact, in the book, The Paleocardiologist, they show that extremely low cholesterol has a similar heart attack rate of high cholesterol. So you think about it, there's this like bell curve of ideal, but how many other factors are there in heart attack? And again, it's not even specific for gender. They've shown that if you haven't had a heart attack, these drugs, it's very difficult to find literature that there's any benefit for women, yet women are treated the exact same as men. But hey, follow the science. I mean, it's just laughable sometimes. And I say this somewhat dramatically because it's time to wake up. For many people, there's people you love and care about that you might sprint to the hospital for, that if they made changes now, you wouldn't have to run to the hospital. They could live longer. They could feel better. They could be a better parent to you. They could be a better friend to you, a better spouse. You could be a better parent, spouse, friend. So, cholesterol drugs, downsides, they can cause brain fog. They're linked to dementia. They're linked to cancer, liver failure, muscle wasting, depression, because cholesterol is a requirement for repair. Cholesterol is a requirement to make serotonin that can help you to have a better mood. Cholesterol is 70% of your brain and spinal cord. And if you don't have enough of it, you can have plaquing easier, which is why it's linked to dementia. It's such a strong drug. It also affects energy. Statin drugs, not only do they stop the production of cholesterol in your liver or reduce it, they also decrease your production of CoQ10. And if you're not seeing a medical provider that when they give you that statin, they also recommend CoQ10, they're doing you a disservice. Flat out, they're doing you a disservice. CoQ10 is essential for metabolism. So for not gaining weight, for having energy, it's essential. And yet many people are on these drugs because it's a low dose, but that low dose is damaging their body over a long enough time. It'd be like saying, hey, I'm just taking a low dose of cocaine because I want to stay awake. Not the best life choice, even if low is better than high. So, the finish to the heart disease portion is aspirin, Coumadin, warfarin, blood thinners. What they've shown, over time is that your body tries to thicken your blood again. There's an underlying cause. And what's crazy is, excluding aspirin, these stronger medications, they can cause you to have bleeding. They can cause your skin to thin. They can cause, that you can't eat leafy greens or take vitamin K because that's a blood clotting agent. But it's a natural blood clotting agent. Your body knows exactly what to do with vitamin K. And how have we gotten into a world that we're saying take a drug that also is used for rat poison to kill them, but don't eat vegetables, don't eat leafy greens? That's the bad thing. It's insane. It's insane to think that that's a great choice, yet so many people are on these drugs because it's recommended. And you may love your doctor, your doctor may be a great person at heart, they may just not understand or be enlightened or whatever, but ultimately this is why we offer an integrative approach. And so I've had a lot of people tell me lately, I didn't realize that I could see nurse practitioner Abby for primary care, but you can utilize Abby as a practitioner or as your primary care. She can refer for blood work. She can legally modify your medication. She can help you with supplements and lifestyle choices to help you get off. And why did we bring her in? Well, we've certainly worked to help empower people for years. You need more time. You just need more time. And for our chiropractors, while they work very hard to be educated, we can't legally take somebody on, put somebody on, or take somebody off a drug. I can't refer out for blood work. And if I'm being honest, I don't have the time to sit down with 1 hour per person to go through all that stuff. but that's what we do with Abby. Abby has your initial client appointment that is a combined total of an hour. Follow-up appointments are blocked for 30 minutes. Now, you might not need all that time, but we set aside longer hours, triple the national average, so that you have the opportunity to really get a comprehensive approach to your healthcare. And so if you know you need to make a switch, you can either call the office, or I posted right on here, imorockford.com, to schedule an appointment to come see her. We are accepting most major insurances. If you aren't sure, you can contact the clinic to see if you're in network or if we're in network with your insurance. But it's the exact same as seeing another physician, except better, in my opinion. Now, to move on beyond heart medications, the next couple of things we're going to talk about are painkillers and reflux medication. So one of the things that's ironic, when somebody's in a lot of pain, often they'll go to the ER and their blood pressure will be high, and so they'll be put on a blood pressure medication. When the pain goes down, they're not taken off the medication, even though the reason for the increase in blood pressure was the pain. Now, Nsaids, which are things like ibuprofen, Advil, Mobic, essentially probably one of the most common, if not the most common anti-inflammatory, one of the most over-the-counter drugs. These have huge, huge side effects. And what do I mean by that? Simply taking ibuprofen is shown to damage your liver and kidneys. But more than that, when you see people have allergies or food allergies or stuff like that, Nsaids are linked to leaky gut. They're literally shown to be so bad for you that they put holes in your intestinal tract and allow food to leak through. Your body treats them as an inflammatory compound and can develop an allergy to them. It's why when we do food allergy testing, we sometimes see weird things like people are allergic to cantaloupe, or people are allergic to kale, or they're allergic to some of the foods that they eat most frequently. Well, why is that? If they've taken medication over a long enough period of time, they may have leaky gut syndrome, which then leaks those foods in and can turn them into an allergy, can turn them into damaging instead of healthy food. And so that's where one of our programs, the Gut Heal and Seal program, is so effective, is to figure out how to heal your gut, test it for which foods you need to avoid, and then seal it with a combination of probiotics and other supplements to fix what you might have caused for yourself over the last 10, 20, 30, 40, 50 years. But painkillers specifically are in the top 4 consistently. And keep in mind, like drugs like chemotherapy are in the top 4 for highest adverse reaction rates, highest side effect rates, and many of these drugs can be taken over the counter. So when you look at the true cost of taking ibuprofen isn't 20 cents. The true cost of taking ibuprofen might be hundreds, if not thousands of dollars, because of what it's doing to your body over time. It's also linked to raising blood pressure. So if you take painkillers, you might be damaging your heart and causing other issues, which cause another drug and another drug and another drug and another drug. Now, acid reflux medicine, this is another one that is absolutely baffling to me. Some of the things that I see people have most fear for as they get older is cancer and osteoporosis. And what do acid reflux medicines link to? Both. Both. I'm going to say that again. Osteoporosis and cancer both linked to acid reflux medicine. But yet I can understand with the pain of having acid reflux. I can understand wanting to avoid it. But also people often take acid reflux medication because they're worried about getting cancer in their esophagus. But yet, again, the side effect of the medication is the same thing they're trying to avoid. So there are other integrative approaches, not just Gut Heal and Seal, but things like Max GI, taking supplements that can kill the bad bacterial overgrowth that cause the acid reflux, again, getting to the root cause of the problem, and then supplementing to put the right probiotics in, realign your digestive tract, and get rid of the reflux, not for 8 hours or 12 hours like you might take with a pill, but get rid of it over the long term. So acid reflux meds, and why, the last thing I'm going to say, because we've seen more kids with this, did you know that from a chiropractic standpoint, kids under 2 years old, the top reasons they come in are ear infections, acid reflux, and colic. 3 of the painful things for parents to watch their children be in that are common. Now, you think about this, What does an acid reflux medication do? It raises the pH of the stomach so that the food, the acid isn't as damaging, but the downside is it doesn't break down the food. Think about that. It doesn't break down the food as effectively, and so less digested food goes into the intestines to be absorbed or to be digested, which means less nutrients often are absorbed. Now, if you don't absorb as many nutrients over a long enough period of time, of course, you're not going to be as healthy as you could be. So if you need to take this for a week or a month, that's one thing. But if you give a child who's supposed to grow and develop something that's going to cause them to not absorb as much nutrition, there's a problem there. If you're going to give an adult something that's not going to allow them to absorb as much nutrients over the course of decades, why wouldn't they be more prone to cancer? Why wouldn't they be more prone to osteoporosis? You're not going to absorb as much calcium from the food that you eat. Think about that. If you don't absorb the calcium, your body has to pull calcium out of your bones to balance the pH in your blood, and therefore it causes osteoporosis. The number one cause of osteoporosis is toxicity. The number one toxin consumed in America is medication. Why should you take an integrative approach? Some of you, I'm preaching to the choir. Some of you, like I said, need to wake up, need to look at this. I mean, an integrative approach, the less medication, the more food absorption, the more proper supplementation, the better off you are. Now, just to cover a few more here, a little quicker. First of all, antidepressants. Antidepressants are something that are meant to be on for a short-term period of time. They can severely damage your kidneys. They actually, many of them are linked to increased suicidal behavior. And again, some of these, there's if you're also on a cholesterol lowering medication, it's tough for your body to make the serotonin. So I'm not saying if you're fighting depression that an antidepressant might not be necessary for a period of time, but did you know you can look, there are tests that can be done integratively that can look for your that's called, it's a big word, it's called neurotransmitter precursors that can help figure out where your body's not necessarily producing the right amounts of the hormones that help you avoid being depressed. There's also things like counseling, which can help you manage it. But again, I'm not saying don't take an antidepressant, but there are better ways over the long term, and you have to know what it's doing to your body. My mother took an antidepressant for 14 years. We're still working on her getting her kidneys to heal all the way, and she's been off for over a decade. I mean, there are some long-term damage that can happen when somebody takes a drug over a long enough period of time. When you talk about diabetes is still the number one underlying trigger to heart attacks or heart disease. And what was the number one killer last year still? Heart attacks. No matter what the news says, heart attacks still the number one killer, diabetes, and yet weight gain, relying on drugs like metformin and insulin and other diabetes medications that can severely damage the pancreas. So when people go on these, what's crazy is many times the drugs could cause them to die earlier than the disease. Now, not always, and not when it's managed properly, but you have to think about, are you taking responsibility for what's going in your body? Diabetes, specifically type 2 diabetes, is what I'm talking about. For the majority of people is reversible, partially reversible, or fully avoidable. But sitting at home, living in fear, eating crap, and gaining weight is not a great way to avoid type 2 diabetes. It's just not. And so if you kind of fell into a depression with all the lockdown stuff, if you gain some weight, I mean, I know you probably know what to do, but if you need help, if your body's not losing the weight like you should, we have weight loss programs to look at why is your body not functioning at the level that it should. We can look at your thyroid so much better than it's looked at from a traditional medical doctor. We can test your adrenals. Many people don't even know what the adrenals are. The adrenals are these little glands that sit on top of your kidneys that produce your stress hormones. And for people as they age, especially, this is most notable for women, help produce your sex hormones like estrogen as your sex organs produce less. Now, for so many people, they're fatigued or burn out. 95+% of people have adrenal fatigue at a minimum, meaning that because you've lived in a level of chronic stress, whether that's physical stress or more commonly at this point, mental stress, that can cause your adrenals to fatigue. And if you're not giving them the right nutrition or supplementation, if you're not, for instance, so many people are so dependent on caffeine that can burn the adrenals out. If you're getting fatigued late morning and late or mid afternoon, you probably have adrenal fatigue, and there are ways to help those to heal, to give you more energy, to help with stress hormones, to help with losing body fat. So as you age, you may need to look at, how do I support my body correctly to take this weight off efficiently? Another thing, as people age, if for instance, that have adrenal fatigue, if they have adrenal fatigue, they often then, another thing for mood and things like that are hormones. So birth control, while I understand why some people take it for family planning, birth control can really damage a woman's body, increase risks of cancer. I mean, all sorts of stuff. And hormones, when women go through menopause, again, major issues. Thyroid, synthetic hormones, taking insulin. The more insulin your body has, the less fat burning or leptin hormone it's going to produce. And then here's the other thing. Let's talk about the immune system for just a moment. I've had so many people this year, more than in my entire professional career. I've seen more vaccine injuries in my clinic than I ever have in the last 10 years. And of course, everybody can infer why. I just watched a great video from a brilliant medical doctor. And if you look at the VAERS, the government's reporting, there are now more confirmed deaths from this vaccination than the last 20 years of all their vaccinations given. Just in the last 5 months, more deaths confirmed than the last 5 months. But let's not talk about that. Let's go back to I hear people say, I'm getting the shingles vaccine because I heard shingles is really painful. If we go through the history on this, the shingles vaccine now has a super shingles vaccine. And what's it super in? It's super in heavy metals. It's super in things that cause all sorts of damage to your body. And so when people think, oh, my doctor recommends it, it must be safe, talk about a blind faith approach. Now, I've done this on past seminars, so I'm not going to go through this in much detail, but the flu shot has been shown to be incredibly ineffective year after year. And there's a bunch of reasons why. And if you watch these seminars before, you know why. If you don't know why, go back and watch one of the previous seminars. But it's ineffective in most cases. And the current marketing says, well, if you have the shot, you might not prevent you from getting the flu, but it will last for a shorter amount of time and it's less serious. Find me some research on that. I have yet to see it. Now, maybe there is, but find me some research on that. It's just, and there's this funny thing about, that same marketing ploy is currently being used, whether it's true or not. I'm not saying it's not true for this current one, but they've been saying it for the flu shot for a lot of years, and there's really no research. But when I interviewed nurse practitioners for Integrative Medical, 8 out of 15 that we interviewed were newer grads or worked in the hospitals, and the new grads had just literally been brainwashed with that information, coming right out of school. But yet they'd never seen the research on it. I asked all 8, and again, this is a subjective piece of research. Did you ever actually see the research on that? And then there was just dead silence. Following the flu shot not working, pneumonia actually is what's linked to or what's blamed on most deaths. Even with COVID, pneumonia is a big issue. And if we go back to the flu, it was, the flu only kills about 6,000 people, but the flu causes people to have pneumonia, so you need to get your pneumonia shot. Now, keep in mind, if you're immunocompromised, your immune system might be weakened from getting these shots for as much as a month. So if your immune system's weakened for as much as a month, 2 different times in a year, and you're stressed, shingles is simply a virus that's already in your body coming out because of a weak immune system. So actually, the amount of shingles in this country went up significantly at the same time that flu and pneumonia went up. The shots. So when your immune system gets knocked down, shingles is more likely to come out. And then it's not even effective. It was essentially when the shingle shot came out, the piece of research I personally saw showed that 3 out of 100 immunocompromised people could get shingles in any given year. And if you got the shot, 2 out of 100. So a 1% net gain. But what do they say? 50% less shingles if you get the shot. That's still 1%. It saves you by 0.5%. It's crazy. It's crazy to think about. Yet when the shingle shot didn't work at preventing shingles, now they do the super shingle shot. And think about this. All of those shots have heavy metal in them. All of them have a mercury or aluminum, which are linked to all sort of neurodegenerative diseases like MS, dementia, Alzheimer's, weakened immune systems, trouble with your digestive system. It's all linked. And so what our programs are designed to do is to help you have less of those things in your body. So the Mountain program has things like parasite testing. We test your hair and we look for heavy metals. We look for mineral imbalances, and we give you supplementation to help with things like your adrenals, your thyroid glands, getting the heavy metals out of your body, killing parasites, which can be so damaging to your body. Additionally, our Gut Heal and Seal program that I mentioned earlier, Gut Heal and Seal can help you seal your leaky gut, help with food allergies. One of the surprising things to me that Abby had said would happen, so many people on the Gut Heal and Seal program are noticing serious improvements in their mood. It can be used for to try and help people with like I said, depression, high blood pressure, weight loss, pain, inflammation. There's just so many things. We now have a new program that I'm going to go through in more detail soon called the NutriVal. That's something that we had previously, but now we're able to get it partially covered by most insurances, so it's less cost out of pocket. So our Integrative Clinic offers both a opportunity to have the best of what medicine has to offer, opportunity to test your blood, receive medication when you need it, but also help you off those things safely and effectively when you don't. Additionally, going through what are the right supplements, what's your body need, what are you missing, and then also the natural options of testing for food allergies, testing for vitamin deficiencies, testing for mineral deficiencies, giving you lifestyle advice, and like I said, 3 times longer appointments than the national average. So if you haven't already, we basically have 2 options. You can, as I mentioned, use your insurance. In most cases, we've tried to get out with every possible insurance company. But additionally, we offer a 15-minute consultation if you have a specific topic in mind. And so the 2 choices are to call or go make an appointment through the website. You can schedule a 1-hour new patient consult for any of these things that you're interested in. Anything from simply a wellness assessment, going through your supplements and trying to live your best health, or if you have any sort of a disease or disease condition like high blood pressure, diabetes, high cholesterol, kidney problems, thyroid issues, depression, any weight loss resistance. My suggestion is always to make the 1-hour appointment. But if you just need a little more information, we do offer several 15-minute consults every single week. And you can call, schedule. If you do need the best possible advice, we often will have to schedule you 2 to 3 weeks out, and you'll have to come in and fill out a release of records form so we can get all your past blood works from your other physicians. And you can come in and be assessed. You can test it out. You can really have an opportunity to get to the root cause of your problems and live your best life. Tune in on Friday. We're going to continue to go through the NutriVal, more on everything from how to heal joints to what vitamins you can take, how to naturally boost your immune system, and what are your other opportunities for taking care of your health in a more integrative approach. Have a great and blessed day. Thank you.